So this is a person you've seen unconscious.
Okay.
You don't know anything. It's a roadside person who at home also.
Okay.
So what you need to see before approaching the patient, see the scene.
Okay.
So is the scene safe for me to go and rescue, and is the scene safe for him to go and rescue? Like in a water or middle of the road, it's not safe for both of us.
Right.
So we bring him to the safety, make him lie down. Okay. So now what we do a check. Okay.
Okay.
Hello sir. Hello. This is how you call him.
Okay.
So 2 times. Hello sir. Are you awake? Are you okay?
Okay.
So if you know the name, you call by the name. Otherwise, hello sir, hello madam, or whatever in Telugu also you can whatever. So now after checking that, you know that he's not responding to you.
Okay.
He's unconscious totally. So now you have to check the pulse and breathing. So how will you check the pulse? So I just for demonstration purposes, I'm lifting it here. We have a nipple line here and the midline here in the neck. Okay. Where we do compressions is here with the junction of nipple line and the midline. This is where we do the compressions. But where do we check the pulse is here. See, if you see your Adam's apple here, sir, you do palpate Adam's apple. Okay. So now slide it to the left or right. In the first dip, put your 2 fingers like this and then press.
Yeah, I'm able to find my pulse.
Okay. Now that you have checked on the one side, check on the other side, sir.
Okay.
Can you do it?
Yeah.
Same way in the patient also, you will have to identify the Adam's apple here and then slide first dip, go and press with the 2 fingers.
Okay.
Understand? So now don't go very back here, you will not be able to see. So it's just beside the Adam's apple here. Okay. So now I use both the hands very wisely here because we are running out of time for the patient. So now my 2 hands on when I'm on the right side of the patient, I'll use my left hand to check the pulse. I'll use my right hand to put on the chest or the abdomen to see if it is moving for breathing.
Okay.
So like if I'm putting myself, if I'm breathing, my hand will move like this.
Right.
So like that, if the patient, if you put a hand like this, it will move up and down if he is breathing. So I'll check the pulse and the breathing at the same time for about 5 to 10 seconds, just like this. 1, 2, 3, 4, 5, 6, 7, 8. I'm not able to check the pulse.
Okay.
I don't feel a pulse, or the patient doesn't have a pulse. These 2 scenarios, you can directly go and start the CPR. But before going this, you will there is another very important step called calling for help, sir.
Okay.
So no one should forget this. So once you identify the patient is unconscious, the second you do that, you have to ask, please go call for help. Like if you are there beside me, sir, please call ambulance.
Ambulance. Okay.
108 or nearby whatever the ambulance is there, nearby whatever is there, please call for help. So the minute you do say that, there is a way to asking for help. So you call for ambulance and you will tell exact location where you are. So the road, the landmark, so that they can, what is the route to come to that particular place and how to go about from that particular
maybe we can share the location as well.
Yeah, that is if it is very difficult for them, we can share the location. It's very easy now because of the smartphones.
Right.
So, but 108 sharing location will be little difficult.
Okay.
What you do is you should tell them the landmark first, so that they'll identify which ambulance is nearby that one, and they'll dispatch. Once the ambulance is where, that person will call you. Then that is when you can share the location to them. Okay. Yeah. So in that way, you can call the ambulance. The minute the ambulance is called, then again you should come back to the patient. If you are alone, not any person, so that is your job to call for the ambulance and then do the things simultaneously.
Okay. Yeah.
Okay. So that's
maybe switch on the phone, keep on the speaker, and do both things simultaneously.
Yes. If you have a Bluetooth or something, yes, you can speak over the Bluetooth. It's very easy. Or you can put like this and then you can do, that is easy. Okay. So once you know how to do things, it's very easy to how conveniently you can perform that person. So now that we have known that there is no pulse and there is no breathing, you already call for the help. The next step and important step would be doing chest compressions. As I told you, CPR means Cardiopulmonary Resuscitation. So cardio is restarting the heart, pulmo is restarting the breathing. Resuscitation is giving a life again by restarting. Okay. So now, as I told you, where do I do compressions? It's a nipple line in the midline of the patient. So I use my hand like this, dominant hand. My dominant hand should be like this. Put my fingers like this, and the non-dominant hand will come and close my fingers like this. And then you should be perpendicular to the patient. That means my have to be straight to the patient, not like this or like this or like this. Your knees, elbow should not bend, it should be straight. So like this. So, okay, now I can do the compressions. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Then I can go for the breathing. So I'll demonstrate you the breathing after this compression exercise. So why don't you try once?
Yeah, so this is my dominant hand, so I keep this in front and I will keep my non-dominant hand like this, and I will ensure my elbow is not bent, so I need to
Little more bending onto the patient, sir,
Okay.
perpendicular, and the elbow should be straight.
Both
This is
the
the
elbows
perfect
should be
position.
straight.
Yes, this is the perfect position. Yes,
Okay.
sir. Do.
1, 2, 3, 4, 5, 6, 7, 8, 9,
See,
10,
the what
11,
you should
12,
remember is
13,
the force
14,
should not come from the
16,
shoulders,
17,
from the
18,
elbows, but
19,
from the
20,
shoulders,
21,
and your back
23,
should be
24,
moving.
26, 27,
Your weight
28,
should be
29,
falling on the
30.
hands rather than only the back moving. Okay, that is more important.
Okay.
Okay, otherwise you will get a backache later on. So otherwise it's very important that your weight of the body will fall on the patient rather than you pressing the patient. You should not use any muscles as such. The weight should do the work.
Okay.
Okay, so now that you have done the compressions, we will do how to do the breathing. So ideally the breathing would be mouth to mouth, but if it your loved ones or if it you are at home, someone who you care about, yes, you can directly go and do the mouth to mouth. I'll just show you how to do a mouth to mouth. Okay, so first thing is you have to pinch the nose of the patient,
Okay.
and you have to seal your mouth around that person's mouth like a normal breath. Don't take a deep breath. Don't do that, like a normal breath. And then seal and then blow slowly. Don't do. Example, if you take a full glass of water and blow it, what will happen, sir? It will spill on you. If it is a hot coffee, how will you do?
Okay.
So it's just like that. So it's okay. That means just a small blow, release of your air into the other person's mouth. So that, and when you are doing that, you have to see from the corner of your eye, you have to see the chest. It will slowly raise. Like this.
Okay.
So that means it is a successful breath.
Breathing.
Okay. So when you do that, you have to open the airway. When you know that airway and foot pipe both are side by side.
Right. Yeah.
And they have a connection in between like this. Okay. So now to make the airway straight, you have to tilt the head like this.
Okay.
Like this. So you have to hold the chin and lift it.
Okay.
So you lift it and then tilt the head. So this is called chin lift and head tilt.
Okay.
Okay. Chin lift and head tilt. Okay. So now can you see this mannequin? Just like this. In this way, like if you are smelling something, you do like this. Why you do like this? Because you are opening your airway.
Right.
You are taking the breath. So that is the reason you have to do chin lift and head tilt. Close the pinch the nose, and then if you are afraid to do that, you can put your hold like this. You can even do that.
Okay.
But there should be a perfect seal. If there is a seal, the air doesn't escape from outside. If there is no seal, the air escapes. So whatever you give will not be going into the patient. Okay, that is how you give the breaths. So you give 2 breaths, sir.
Okay.
And you see the chest is rising.
Okay.
Okay, now one set of compressions, 30 compressions, one set of 2 breaths. It's called 1 cycle.
Okay.
So you do that for 5 cycles.
Okay.
You should be able to finish this in about 20 to 30 seconds.
Okay.
So usually the speed of compression should be 100 to 120 compressions per minute. That means in a second you should be able to do 2 compressions.
Okay.
That is the speed. Even the breath you have to give it in within 2 to 3 seconds.
Okay.
So once you give 5 seconds of this one, 5 seconds of this one, you will take a gap of about 5 to 10 seconds again.
Okay.
In that 5 to 10 seconds, if with both are there, now I have done the compressions. I will come to the head end and you will come to the chest compressions and you will do the compressions.
Okay.
We will change because there is a thing called compressor fatigability. That means when I am doing compressions for more than 2 minutes, I usually get tired.
Okay.
I may not know it, but my strength of compressions will definitely come down.
Okay.
So that's the reason it's called exchange.
Okay.
So compressors will get exchanged and then the other person will do the compressions, then I will do check and breathing in that particular minute.
Okay.
Okay.
Yeah.
So that means you have to change your position for the compressors for every 2 minutes or 5 cycles.
Okay.
So whichever is earlier. Or if I am tired, then immediately I have to ask, okay, I am tired, why don't you go ahead? It's not about numbers here, so it's about giving quality compressions and breathing.
Okay.
That's what we are doing here. So the minute you do here, every 2 minutes you stop and change yourself, you check your breathing and pulse at the same time. So like I did earlier, you have to do this like this every 2 minutes. So once if you get the pulse, that means you have achieved what is called return of spontaneous circulation. That means return of pulse. Return of pulse where the patient can start breathing, may not be able to start breathing. So if he is able to breathe, leave him like that and wait for the ambulance. If he is not breathing, but pulse is there, definite pulse is there, then only support the breathing, like I told. Every 5 to 6 seconds, one breath, you can keep on giving him until the ambulance arrives, and every 2 minutes you keep on checking both pulse and breathing every time. So this cycle will go on, like 2 minute cycle will go on, you have to remember that. And then every time you check, both pulse and breathing has to be checked. So if pulse is there, breathing is not there, support the breathing. If pulse is not there, breathing is not there, support both of them by compressions and breathing. So in this way, your CPR is actually complete.
Sir, I have one question. Why do we pinch the nose? Can you explain?
Yes, see, as I told you, the minute we are blowing, air has a very tendency to escape through holes.
Right.
Okay, so wherever there is a leakage, air escapes. So if you don't pinch the nose, the air escapes through the nose.
Okay.
Whatever you are blowing, it will come out through the nose.
Okay.
So which we don't want.
Yeah.
We want the air to go in. So that is the reason we tilt the head, lift the chin, pinch the nose, put a tight seal, and then do it. As you asked earlier, doubt, if it is a roadside person who don't know who might be having infection or anything, we don't know what it. So post COVID, it is a recommendation to give a breath. We can give it through a barrier. You can use a handkerchief, or you can use a small plastic pipe and you can seal it up and down here with 2 hands, and then probably you can blow.
Okay.
Or you can see it's Indian jugaad.
Right.
You know whatever you want to do, you can do. But ideally, it is to be done mouth to mouth or mouth to mask.
Okay.
Any other doubts, sir, in this?
No, sir. I think everything is clear. So now everyone who sees this video are ready to give a CPR.
Yes,
In a
and
perfect
always try to practice on a mannequin whenever this. We did a recent camp. We have good attendance, sir. Everyone learned how to do it, and they were very happy on doing it. So this mannequin is available with us. Whenever they want to come, they can come practice here and they can go.
Yeah.
So that we can do in that way. So because learning first aid CPR saves a life. Unfortunately, if you remember, our president, beloved President Abdul Kalam sir, has collapsed on the stage, but none on the stage has done CPR there. If they would have performed, probably would have still had him here now.
Right.
So that is the importance of learning CPR. Every person should know this. Every person who sees this video, please try to learn it and then teach to many other people, so that this is a very basic skill. Basic skill like drinking water, like cooking, eating food. It's a basic skill. So you have to do this, then only everything will fall in place. So there are few common doubts when they do CPR. Few of them are like, if the patient doesn't come to consciousness, what should be done? So it is like how long and what.
Okay.
So as long as the ambulance comes, you have to perform this.
Okay.
So up to 30 to 45 minutes.
Okay.
Sometimes it can go up to 1 to 2 hours also. Depends on how many people you have, how effective is your resuscitation. In hospital setting, there are certain scenarios we do about 1 to 2 hours.
Okay.
Because we know what caused, so we try to treat the cause and then do it. So usually they recover.
Okay.
But in other scenarios in the roads and all, you don't know what exactly happened. So this is just a try you are giving. So 30 to 40 minutes is a good deal. By that time, you will have your ambulance and they will take over from you.
Okay.
So once they take over from you, they'll put an IV cannula, they'll put a tube inside the mouth, they'll give artificial breathing, and then they give some medicines to start the heart and all. So that's why we tell how long should I do, if that is your question, until patient becomes awake and pushes you away. Okay, I'm fine, what are you doing on me? If he says like that, that means your resuscitation is good, you are achieved whatever doing. Second, until you can do no more of your own CPR. That means if you do, you get so tired and die yourself, then you can stop.
Okay.
Third thing, until the advanced team comes and replaces you.
Okay.
So these are the 3 instances where you can voluntarily stop.
Okay.
So until that time, as long as you do your CPR, good effective CPR and good oxygenation, it looks like the heart keeps on running, the blood keeps on going and everything. So what happens if I don't do CPR? So it is hardly said that 6 to 8 minutes, sir. In 6 to 8 minutes time, if the brain doesn't get enough oxygen and blood circulation, it dies permanently.
Okay.
So that is the reason, the minute you identify, you start your CPR. If it's been already 15-20 minutes and you want to do CPR, there is no point. So people come to hospital within 15-20 minutes distance and they ask me to do resuscitation. Believe me, sir, in that certain scenarios, I may bring back the heart and blood circulation, but the brain usually doesn't improve and they become brain dead. And they become vegetative state and the family has a big burden on them.
Okay.
So in that scenarios, if it is more than 20-25 minutes, and I don't think it's wise enough to go ahead for doing CPR, but if it is you are witnessing and if it is only 5 to 10 minutes, yes, it is doing. But still being said that, even after 20-25 minutes, the minute you see, you try one set of CPR and see if he is responding or not. That is 5 cycles is one set.
Okay.
So 5 times compressions and breathing is one set. You do one set of CPR and see if he is responding or not, and do the call. If he's not doing, then leave it alone, sir.
Yeah. So if the brain doesn't want to be dead, it has to be performed within 5 minutes. It has to be stopped.
Yes, 6 to 8 minutes is the time where the brain completely shuts off.
Okay. After 8 minutes, you can restore the
You
heart.
can restore the heart, but brain will not be functioning.
You can restore both heart and breathing.
We can. That's what we may be able to do it, but that is only a defensive response from the brain. But the full function of the brain may not come. May not come.
Okay.
That we will know only after the recovery of the patient. How long it will take, no one knows.
Okay. Then after 20, the patient has collapsed. There is no pulse and respiration for 20 minutes. After 20 minutes, there is
even if you do, the chances of recovery are very less, is what we say. We don't say any definitive statements that they will die or the chances of recovery of brain and heart is very less after that. So, and there are certain things called automated external defibrillators. It's called AEDs, which are available for commercial purpose and residential and other purposes. If you can keep in your hospital also, it's well and good. That means you need not know about ECG rhythm and other things. So they're like, why do heart stop? When we say heart stop, the person becomes unconscious, right? So why do heart stop? There are two ways. It's like, because there is no blood circulation, then heart stops. There is a clot. Before stopping, the heart becomes like this, pivot.
Okay.
Before stopping completely, it pivots. So what we need to do, this is very bad for heart.
Okay.
That means it uses up all the energy. And even if you restart, enough energy is not there to give a proper beat.
Okay.
So we need to stop this. How do we stop this? Is by giving a shock.
Okay.
So how do we shock? Is by giving the defibrillator. Okay. That is called defibrillator. In the hospital, we have defibrillator. We see the rhythm. Okay, we know what to shock, what not to shock. But here in outside scenario, we call devices called AEDs, Automated External. That they are automatically, they recognize the rhythm. They say this is the rhythm we need to shock. So shock the patient.
Okay.
So it will automatically charge and deliver the shock. Okay. Those are the little more advanced CPR mechanics before you get a help.
Okay.
So this is another thing. Then the third one, the doubt which the people get is, sir, if I'm pressing here, what if the ribs break?
Okay, yeah, that is also one of the
commonest and doubt, very common doubt for everyone will get. Right. So what if the ribs break? So my single answer to you is, if the patient doesn't live, what will you do with the normal ribs?
Okay. Yeah.
Correct?
Yeah.
So a living patient with broken ribs is always better than dead patient without normal ribs.
Yeah. When we assess the risk-benefit ratio.
Yes, risk-benefit ratio. And believe me, when you do exactly on the sternum here, the point which I said, the midline and the nipple line, if you do here, the compressions here, from here, ribs don't usually break, sir. Okay. When you do the compressions on the ribs here, on the chest here or here, then they break. But if you do here, as long as you do here in appropriate pressure and appropriate speed, ribs don't break.
Right. And what about kids, sir? We see the kids. And
yes, very good question, sir. Excellent question. The compression is same, but the amount of force you use is less. So if it is a bigger adult, you are using 2 hands. If it is a bigger child, then you use 1 hand. Okay. If it is a small kid, use 2 fingers. Okay. But the place where you compress, the number of compressions when you are alone is all same. Okay. It all depends on infants, neonates, what we call it, neonates and infants less than 1 year. Little difference, that is 15 compressions, 2 respirations in them. Okay. But adults and other children,
after 1 year.
After 1 year, if there are more than 1 rescuer, then again 15 compressions and 2 breaths for up to 6 years.
Up to 6 years.
After that, it is 30 compressions and 2. If you are alone, for everyone it is 30:2. Okay. If you are alone, it's always that. Because the reason being why, because when you give 15 compressions, 2 respirations, that means you are giving more number of breathings for a patient in the stipulated time. But for children, it is more commonly respiratory arrest. That means the stopping of breath leads to the arrest for them. For adults, it is cardiac. Okay. That is the reason we give more compressions in adults, more breathings in the kids.
Okay, it depends on the age. If it is below 16, below 6, it
6 to 8.
Yeah, 6 to 8. It should be 15.
More of respirations than compressions. Okay. Then that is when you achieve 15:2, more than 1 person. Okay. If you are alone, doesn't matter which age, what age, it is always 30. Okay. Okay. Yeah. So any other doubts in this?
No, sir. I think everything is got it cleared. If any doubt is there, just keep in the comments. We will have one more session based on your comments. If you have anything comment, we will bring him again.
Okay.